Kotido Health Centre IV is strategically located in the town centre. It always looks well kept, and it is easy to forget that it is in the remotest of parts in Uganda. When it comes to integration, the hospital has gotten it right. They have a youth centre, which is right behind me, where most of the youth come to be told about diseases such as HIV, herpes, gonorrhea, and even being told about abortion.
Then we also have games that always keep them busy to avoid them from drinking alcohol, prostitution.
The youth centre was started in 2011 with the help of Red Cross. The peer educators are at the centre because the youths can easily run to them other than the elders back home when they have problems. The centre, which acts almost as a referral hospital, wants the government to elevate it to a referral status to accommodate the over 80,000 people seen here annually.
Sometimes we lose some of our patients just because of distance. You might need to carry out an X-ray on a patient. You don't have that service here. Health Centre IV does not have that service. So we have to run to the next district for a service. For instance, now ambulance is broken down. The patient is forced now to go public. Get a public means rush there.
Most people in this area are poor. Lunch is a dreaded affair, but come it must. Those who can afford to have a cooked meal do so. The hospital offers none. For this child, the saucepan may or may not meet the stove. It is past lunchtime and the mother is still doing laundry. Others, way past breastfeeding age of 2, suckle from their mother's breasts. Main diseases that bring people to this health centre are malaria, diarrhea and fevers.
Mallards, they are also there, though we have a therapeutic department where we carry an nutrition assessment, and we also feed these children, supported by UNICEF/WAP.
According to the in-charge, the maternity ward section is fairly provided for, with enough delivery space and enough room for mothers. But there is no electricity, yet they have equipment that requires enough power, like the incubator.
If we get a child, we need to put in the warmer, we really fidget with it. There are other shortcuts we medics have. We wrap in cotton and try to keep it in a warm area.
It is, however, not a frequent occurrence. In a month, they can have about 3 premature deliveries.
Our people normally really have space in their children. These mothers take time. It is a local community, but there is a way they do their things.
This, however, does not alienate them from most women in Uganda, who have on average about 6 children in their reproductive life, according to the 2011 Uganda Demographics and Health Survey.
Our people marry at a very small age, 16, 17. So by the time a mother reaches 30, how many children would that be at a space of 2 years? About 7.
In a month, about 25 babies are delivered. The busiest months see about 40. But there are health centre 3s in each sub-county that are mandated to carry out deliveries. The hospital has a standard functional theatre befitting a health centre IV. This is one place where power is constant. Solar is used during day and a generator at night.
You have seen it's a busy theatre. We have about 3 to 4 mothers a day. The main challenge is we have a bed which broke and we try to improvise one.
Most women come here because of obstructed labour.
The attitude is changed a little bit. Stakeholders have gone around telling people, we have a VHT group moving around to tell them, please go for these services.
However, the main challenge remains the personnel.
If you look at the government standard of an health centre IV, you have 3 midwives to run a maternity like this one of ours with 1 nursing officer. This is inadequate, really.
There is only 1 medical officer who helps in emergencies. He doubles as the acting director of health services in the district. Sometimes the hospital gets help from doctors from other private hospitals. It is such shortcomings that have convinced the staff that the time to demand for a referral status has come. Florence Naluyimba, NTV Kotido.